Today our lecture on chronic obstructive pulmonary diseases, or simply we call it COPD. So what is COPD? COPD is a disease state characterized by the presence of airflow obstruction due to chronic bronchitis or emphysema. Airflow obstruction is generally progressive and it is partially reversible by bronchodilator. Let's shortly describe chronic bronchitis. So, chronic bronchitis is a clinical disorder characterized by productive cough on most of the days for at least 3 consecutive months or more than 2 consecutive or successive years. Emphysema is abnormal and permanent dilatation of air spaces lying beyond the terminal bronchioles and accompanied by destruction of their walls. Now let's come to etiology. Factors that cause COPD included cigarette smoking, which is the most common and important cause of chronic obstructive pulmonary diseases. Secondly, air pollution, then host disorder including alpha-1 antitrypsin deficiency and exposure to toxic chemical for long term. All of these are etiological factors which worsen the condition and cause the COPD. If we talk about pathogenesis of COPD, so in chronic bronchitis, hypertrophy of mucus secreting gland and increase in number of goblet cells in bronchi and bronchioles with a consequent decrease in ciliated cell. In emphysema, there is a distension and damage of lung tissue and leads to expiratory flow limitation and air trapping here. Loss of alveoli result in decreased gas transfer and loss of lung elastic recoil result increase in total lung capacity. Sign and symptom of chronic obstructive pulmonary disease including cough, which is the most common symptom, expectoration, and dyspnea, which aggravated by infection, exercise, and smoking. If we examine these patients, on inspection, a sign of advanced airway obstruction, patient is dyspneic, accessory muscle of respiration are used, pursing of lips, tracheal tug, so trachea descent during inspiration, and jugular venous distension during expiration, and chest become barrel shape. On palpation, apex beat not palpable, and chest expansion decrease due to airflow obstruction. On the other hand, if we talk about percussion node is hyperresonant, loss of normal area of cardiac and liver dullness. If we auscultate COPD patient, now the breath sound will be decreases, coarse crepitation at lung bases, both inspiration and expiration phase, but change in character or disappear after coughing. Bronchi at expiration, which is an abnormal lung sound. Let's come to investigation. On chest X-ray, prominent pulmonary artery at both hyla, teardrop hurt due to overinflation of lungs, and hypertranslucency of lung field. Now, if we perform pulmonary function test, forced expiratory volume in 1 second is reduced from 80%. Ratio of forced expiratory volume to vital capacity is also reduced. Let's talk about medical management of COPD patients. Management of an ambulatory patient to encourage smoking cessation. The only drug therapy that alters the natural history of COPD is supplemental oxygen in those patients with resting hypoxia. Bronchodilator like ipratropium bromide or Ventolin is advised. Oral theophylline is a third-line agent which are used in COPD patients. Antibiotic therapy are required to treat acute bronchitis or to treat severe exacerbation of COPD. Amoxicillin or augmentin 625 mg hourly. Clarithromycin 250 to 500 mg twice a day. A 5 to 10 days course of treatment is usually effective for COPD patients. Two types of corticosteroid are used in COPD patients. Number first, inhaler form. They reduce frequency and severity of exacerbation and recommend in severe disease like beclomethasone. An oral corticosteroid, they are used during acute exacerbation of COPD. A trial of 2 to 4 weeks and spirometry performed after and before therapy. To manage surgically COPD patient, we perform bulectomy, lungs volume reduction surgery to relieve dyspnea in patient with advanced emphysema and lung hyperinflation. And lastly, lung transplantation. If not responding to medical therapy, we perform lung transplantation. So that's all about COPD. Any question or suggestion you can freely ask in the comment section. Please don't forget to like, subscribe and share our video. Thanks for watching.